Today I'm going to take you through a flow exercise, a rehab concentric only range progression flow for the nerves in the arms and the neck. And what I figured out, now I've tinkered a lot with the rehabs for the nerves. Initially my fingers used to really hurt. I couldn't lift my fingers. It used to burn quite a bit. When I even just playing like a video game, and then I started thinking it was a tendon issue, so I started just doing basic dumbbell wrist stuff, but I still had the issue on my elbows, and then I later figured out through testing the nerves lengths through tension test stretches that they were really tight, and so I started to mess around a lot. I saw a bunch of tutorials on the nerves. A lot of the tutorials I did see were all saying, be very careful. Like, don't tension your nerves too much. Like, they don't like to be pulled. But what I figured out and started to tinker out with was that if you brought a pump to the nerve, it makes it more compliant and more pliable and more able to get longer, and it's the same for muscles and tendons. So that's where I started to think, and I asked some of the ATG guys if that was the case, and I said yeah, but no one, there was a bunch, they have videos on the nerves too, but they have a lot of nerve flossing stuff, and flossing is good for breaking up an adhesion if there's something on the nerve and it's stuck, and that can help break it up and free the nerve. But if it's tight for some reason, then autoimmune issue related, or what gives the most relief is getting the nerve longer. But it's much more better. A fundamental principle is to get bring a pump to the tissue. That's just a rehab principle, is increase blood flow to the tissue you're trying to get longer. And the best way to do that, the blood flow, is concentric movements, so not eccentric. Eccentric's lengthening under load. Eccentric's a more structurally damaging motion, and doesn't emphasize blood flow as well. Same with stretching. Stretching's just a passive eccentric. It's not very effective, but that squeezing motion is what brings the blood flow and the pump. And so you can manipulate the exercise you're doing to emphasize more the concentric squeeze and less the damaging motion, especially when rehabbing, when it's already quite damaged or sensitive or sore. You don't want to be very damaging to it. You want to be efficient but effective and bring it so the squeeze brings the pump, and the squeeze is also less damaging. It's that concentric only, like the backwards walking stuff. That's a way to bring a pump and blood flow and healing to the tissue in a less damaging way, and it's just really good for healing. And so I'm going to attempt to walk you through the flow that I took about a year or two to figure out, but now it's been really good, and I just use this flow that I'm going to show you. So yeah, I hope you enjoy. So why this is important is because I went to see a neurologist, and neurologists, they specialize in rehabbing nerve issues with people. So when I saw this neurologist, unfortunately I didn't record this appointment, and it would have been the best audio recording I probably would have captured. I did capture quite a few other things, but not some of the more severe ones, unfortunately. I don't know why I don't know. But this neurologist, when I was talking to him about bringing a pump to the nerve, he's like, oh no, blood flow doesn't matter. And it doesn't matter if you stretch hot or cold, which isn't correct, because when you bring a pump to the area, you're also increasing blood flow, but also warmth too, because we're warm-blooded. And it annoys me when I see people stretching in a cold pool. It's a lot. And like, imagine stretching in a lake. Like, your tissues are kind of viscoelastic. They're sort of like rubber bands. And if you can freeze a rubber band, and it's more able to break because it's the material. But if you heat a rubber band, it's like stretching in a cold lake, cold frozen lake. Like, what do you think is going to give the best results? Stretching in a cold frozen lake, or stretching in a warm hot spa with a pump to the muscle that you're stretching? If you bring a pump to the muscle first and then you stretch it, the length you can gain is much more and much less painful, and it's more comfortable. So the tissues can receive that extra stress a lot better when there's a good pump to the area, or good enough pump. The more pump, the easier it is to receive, but you just do the pump that you can manage. So anyway, enough talking. I'm gonna flip the camera around and go through a flow that has been really helpful for me and has taken away a lot of my elbow pain for the nerves, a lot of palm pain, neck pain up into the shoulder pain. So yeah, that's cool. Now you might be like, why the fuck is your room a mess? Why do you have piss in these bottles over here? It's because I'm injured and it's actually pretty hard for me to clean my room. I have to get people to clean my room. It hurts a lot. Like too much to where it's just... Anyway. Getting worse. So what I've found, I think the best way to start is with the supinator, pronator supinators, because there's something about, like, it sort of opens things up. I don't know what it is, but I used to start with the hand and then that, but I found that starting with the pronator supinators, and sometimes the nerve tightness, I can like just do that and it'll click, and I can like click open my... So I just bring a banded. Bands are really nice because we can keep it concentric dominant and just sort of let go for the eccentric. And so the range for the pronator is about here. This is about the shorter range, and this would be the long range for the pronator. So all we're doing is just getting a pump into the pronator, and then we'll hit it with the long range after with something like this hammer, this little hammer. Supinator. It's ideal. You can kind of... I'm just going to be showing what I do. And you don't have to follow it exactly. You can use it as a rough guideline, and you can edit it, you know. But this is quite nice. I like if I had a bed, if I was on my bed, I can like bounce the hammer. So this is supinator long range. It's going to hit more the tendon and just open up, get the short and long range. You don't want to train just short range. The long range will help open up the wrist. But I like getting these like bouncing squeezes, concentric blood flow. It's nice. And I'm gonna do this one. Actually, we might swing around. Please see me around. So this, now we're doing, so we just did pronator, and now we're doing supinator. So this would be the shortest range for the supinator, and this would be the longer range for the supinator under stretch. So I flipped around so I can hit that. I'm just bringing blood flow in. Doesn't have to be always super short, like shorter range. I find the mid-range is usually more comfortable. So between short range is when it's most like locked, like this would be short range. this would be long range for the biceps. But I find that the pump is better when you're passing through the mid-range more, passing through that vascular tissue. And the standing bicep curl is a more mid-muscular range. The long range is a muscular range too. It just also emphasizes the tendon more. So what we're doing with this approach is we're just getting blood all throughout. We're warming up the limb before we hit the nerves, so that when we hit the limb, it's all, because you can't just hit the nerve straight, because it responds better to blood flow, and it doesn't feel as good when you just pull on it cold. So we'll show you how to pull on it in a bit, but pull on it. So I do did I do my long range? I kind of did the long range with the band, but yeah, fucking hurt. And the long range contractions are good because they just get the blood even deeper. Like with the Smith curl. The Smith curl is super key for getting blood flow into the median nerve. So breathing helps. Just do the long range with the band. Now this one's very smart and efficient, what I'm about to show you. Where the fuck is it? Might as well do it with this. But, I'll use this as an example. So you see this band here. So you could do concentric only like that, but a really good way, so we're going to do flexor extensors now. And a way that I like to hit these now, that I find more efficient, is how you can, so this would be extension, and this would be flexion for the wrist, and it's long and this would be the vascular shorter range, and this under stretch would be the longer range. And you want to always want to do the shorter vascular range, mid-range first before you do the longer range. And a way to hit both sides at the same time and keep it like a quicker routine is to do contractions like this. So it's concentric. You're doing concentric only, and you're hitting both sides at the same time. So it's pretty smart. I saw it and I was like, oh yeah. I'll try it with this one. This one's a bit like, I don't have these I didn't have these dumbbells set up properly. Kind of just thought I'd just shoot and just upload it. But the goal is to just get a pump, and you can emphasize one side if you want. We're just hitting the vascular tissue, the muscle, and it's more like, it's also more under stress here, versus if you're like contracting like this or something like that. So the angle of the angle of your exercise, the way you're doing the exercise matters. Cool. It's all warm. This one's not as warm. I usually do this with, this is 3 kg. I usually do it with a bit more. You want to feel a rigorous contraction. I do these larger dumbbells, which are probably too big. Ugh. Actually, they're probably right. And now, so we've done supinators, pronators, flexors. We haven't done the long ranges. So the long ranges, this stretch, so the muscles will come into the hands here, and the tendons. So the muscles are here, and the tendon emerges into a tendon here. So the long range is where the tendon will be under stretch, and I find these are very nice for hitting the long range. And for flexors, you can do that and just do contractions. You're trying to do it smooth too. You're not trying to like have it high tension. You want to go slow to help the muscle take more of it, because the more instantaneous stuff can be more stressful and not really get to emphasize the muscle as much. More the connective tissue. Okay, cool. There are expanders we could do. I think now all I'm going to do is just do some mid-range bicep curls. So the bicep curls, so the approach for the nerves when we get to, I found that doing the Smith curls first, so hitting the biceps and the vascular tissue first, helps a lot with when you hit the nerves on the other side for the ulnar and the tricep and the radial, because it helps for a better contraction. Once you open up here, if you have nerve issues, there's a lot less restriction with contracting on the other side. And that's a principle from the ATGs talked about before. That same applies for the nerve. So I'm just going to lay down here. I haven't actually done it with this setup before. I've done it with my other one. So I'm just going to... Holy shit. Oh, Jesus. Almost gone unconscious. So now there's a mid-range pump to the bicep. Now it's going to help with getting into the Smith curl. We're going to do, might make some room for that. So hopefully you can see all good. Not too bad. I might spin you around. Okay, that should be alright. So for Smith curls are sort of like a crucifixion. And where's the other one? Come on, you bastard. Who the fuck touched my weights, bro?